Wilson's illness. Wilson's illness is a hereditary ailment in which copper accumulates in the tissues of various human organs, such as the liver, kidneys, brain, and cornea, causing catastrophic harm. Symptoms of Wilson's disease. When it comes to Wilson's disease symptoms, they are as follows. 1. Liver disease symptoms. It is a primary symptom of this disease that arises in about half of patients, particularly the formation of liver cirrhosis, and impaired liver function. Active chronic inflammation develops in the liver in a smaller percentage of patients, 10% to 30%. Wilson's illness is occasionally identified by surprise as a result of acute and unexpected liver failure and the appearance of severe jaundice with rapidly rising bilirubin levels in the blood. 2. Neurological manifestations. It can begin with a variety of movement problems, including uncontrollable motions, convulsions and tremors. Movement and speech are both slow. Stiffness during walking, stammering, and inability to unwind. 3. Psychological manifestations. Among the most notable: a rapid and significant loss in mental capacity, personality shifts and erratic behavior, a drop in academic performance, the occurrence of unusual behavior, the onset of symptoms that resemble those of schizophrenia. Wilson's disease causes and risk factors. A deficiency in chromosome 13, in the genes encoding the creation of the enzyme adenosine triphosphatase, ATPase, which functions as a copper carrier in the body, causes the condition. The deficiency in this enzyme disrupts the process of copper excretion from the liver to the gallbladder, resulting in copper buildup in the liver tissue. Ceruloplasmin, the copper-carrying protein in the blood, is found in very low concentrations in Wilson's disease patients. Hazard factors. The most important element that increases the chance of infection is heredity. Wilson's disease complications. Wilson's illness has several severe complications, including cirrhosis of the liver, consistent neurological issues, psychological issues, blood issues. Diagnosis of Wilson's disease. Wilson's illness can be identified in several ways. Examination of the urine. Copper is excreted in large levels in the urine, often in proportions several times the normal level, making it a good laboratory indicator of Wilson's illness. 2. The cornea of the eye is used to make a diagnosis. Wilson's disease is diagnosed by the emergence of brown or yellow rings around the cornea of the eye termed Kaiser-Fleischer rings, which are caused by copper deposition in the cornea of the eye. It is important to note that children with Wilson's disease who develop chronic liver illness do not always have these corneal rings. Wilson's disease is usually diagnosed between the ages of 8 and 20, but copper deposits in the liver can start as early as childhood. Treatment for Wilson's disease. Wilson's disease is commonly treated and accepted as follows. 1. Phenylephrine, which attaches to copper and causes it to be excreted in significant levels in the urine, reducing its accumulation in the body's essential organs. 2. Transplanting the liver. A liver transplant is the most effective treatment for people whose disease has progressed to the point of full liver failure. Preventing Wilson's disease. It is impossible to prevent sickness,